Hi, Leilani. Thanks for coming in. That was super quick, girl. This is Christy Turner with DementiaSherpa.com. I'm your Dementia Sherpa, guiding you through rough terrain. Hi, thank you, Red Hawk, for coming in. And today I want to talk about navigating the hospital system because it's one of those super duper scary things for anybody, but especially if you have a loved one who's living with dementia. Oh my gosh, that can really take it to a completely new level. I went to a meeting this morning that I go to every month. And hi, Epcot Center. Shoot, I forgot your name. Dang it. I recognize your name, though. I recognize your handle. Thanks for coming in. I'm doing a dual broadcast on both Facebook Live and Periscope. So if you're watching on Facebook, Janet, thank you. So if you're watching on Facebook Live, I'm talking to my peeps on Periscope, so thank you so much for coming in. Hospitalization can be super scary, and I went to a professionals meeting this morning, and the panel was social workers from a variety of different settings. So sometimes we can even get a little bit confused about what the various healthcare settings are, so I'm going to take a minute to just go over that real quickly, and then I'm going to offer you some tips, 7 tips specifically on how to navigate through hospitalization, which can be really, really scary. So, and my dog Stubbs is assisting today, so you can probably see him on Periscope. He just popped up. So, hospitalization or the hospital setting is called acute care, okay, which I don't know why you would care about that, but just in case you ever hear it, that's what people are talking about is hospitalization. And one of the main things that the panel was talking about this morning is how difficult it is for them to do their job effectively when they have so few resources to work with. And I know I might have some Canadian and people from the UK watching later. So I am, of course, speaking specifically to the American healthcare system right now, but the tips I'm going to give are good in any country, I'm pretty sure. So, oh, thank you so much, Makisha. I appreciate that. Thank you so much for sharing and inviting your followers. I really appreciate that. So, one of the big reasons that people living with dementia end up in the hospital is obviously because something happened, right, where you think they need hospitalization. Usually it goes one of two ways. People really need to be in the hospital because something is not going well, and the family might be a little bit hesitant about actually making that call, or people really don't need to be there, but the families run out of ideas about what they can do to not be there. They don't know what else to do, so they end up going to the emergency room. So these are some tips that I want to give you about what you can do once you do find yourself in that situation. And I do have, if you're interested, hit me up on any social media. I do have a short little guide about some common situations that happen for people living with dementia and what you can do to manage those at home rather than ending up needing to go to the hospital in the first place. So if you want that, just reach out to me on social media. Again, I'm Christy Turner with DementiaSherpa.com. I am your Dementia Sherpa, guiding you through rough terrain, and you can find me at DementiaSherpa.com or at Dementia Sherpa, or it's Dementia Sherpa everywhere. So all the platforms except Snapchat. So the first thing that you want to do when it comes to going to the hospital, because usually it's going to be an admission through the emergency department or emergency room, is you want to be present. Even if your loved one is living in an assisted living or a memory care or a skilled nursing facility, which is also called a nursing home, a lot of times families don't understand that when somebody gets sent to the emergency room, staff doesn't go with them. They are, hi Fit Mouse, thanks for coming in. They're sent on their own. So if you think about for your loved one how confused they can be just kind of in a normal day when everything's going okay, or how easy it is for them to become disoriented, think about when they're ill, which will increase confusion and disorientation, right? And then being in an unfamiliar environment, which also increases disorientation and confusion. So If they're sent out on their own, which they are, it's really scary for them. So you want to be present if at all possible. And if you personally can't be present, you want to get somebody else in the family or a trusted resource to be there with them. That's a really huge deal. And a lot of times when I was working exclusively with private clients, that was a big part of my job. Is I'd get that call at 2-3 o'clock in the morning because somebody was being sent to the emergency department and the family lived in a different state, which is why I was involved. So I would be that person that was going there to the emergency room to be with them and to advocate for them. So that's the second thing, is you want to be an advocate. Because again, when we think about people living with dementia, they have a really tough time advocating for themselves, right? One of the easiest examples that I can give you is pain. They are notorious for not being able to accurately report pain. They will say no when asked, or they will report some other location in their body different than where the actual problem is. Like, for example, years ago I saw a lady fall and break her hip. It was her right hip. She swore the pain was coming from her left pinky finger. So that's one of those things that, like, I probably would have been skeptical about, except I actually witnessed it and I thought, oh my gosh, wow. So they already have a real hard time speaking up for themselves under the best of circumstances. So they need an advocate who can be there with them, who can say they're on XYZ medications, that, you know, it's normal for them to spend a little extra time thinking of their words. The hospital staff really needs to know what's normal and what's not normal so that they can figure out what's called a baseline. What are they usually like? That's a baseline. And then know how to proceed from there. And this could be really important if somebody has vascular dementia, for example, because that would indicate that they probably have a history of having had at least one stroke or have little mini strokes. The medical term is TIA. You may have heard of that. But they're also called mini strokes, or at least chronically high blood pressure. That would be super important information, right? Now, if your loved one is living in a memory care or a skilled nursing or an assisted living, the staff will make a packet of a list of medications and send that over with them. But sometimes papers get lost in the shuffle. It's always good for somebody to have an advocate there with them. Okay, number 3. This is going to sound like one of those no duh things, right? But it's really important. Be nice. And I'm not saying you're not a nice person, but when we're in a situation that's freaking us out, it can become real easy to not be nice, right? And I totally get it. And I got to tell you, healthcare professionals, you know, all of us, we understand we're not meeting you on your best day. If you were having your best day, why the hell would you need to know us, right? You'd have no reason to know us. And especially in a circumstance like this where it's an emergency, we totally get that. But the flip side is we're only human. So when somebody is speaking to us like we're a fellow human being, it tends to make things go a little smoother, right? And then the professionals can really focus on helping your loved one, which is the whole point. But I can tell you, I understand because I've been on both sides of it, both as a professional and as a family member. And it's hard, you know, when stuff's going sideways and you don't know what's going on, it's scary. And it's real easy to come across as very intense, right? And it's just really hard. Hi, thank you for coming in. It looks like Mert Virgin. I'm sorry. The camera's just far enough away from me, and I'm just old enough to not be able to read it exactly. So thank you so much for coming in. So to refresh, I'm Christy Turner with DementiaSherpa.com. I am your Dementia Sherpa, guiding you through rough terrain because dementia is rough enough. You need the shortcuts. You don't need to make it in anything. You don't have to have any added layers of difficulty, right? Easy is what we're looking for. What works? Let's do that. So I'm giving you 7 tips today on dealing with hospitalization and that whole system. How do you get through that? Okay, so number 4. You want to, I think we're at number 4. Yeah, we're at number 4. So you want to be clear on the outcome that you want, okay? And this is one of those things where I'm always advising people, you want to have an idea about what you would do if. I call it the if-then game, right? So if your loved one had a stroke, let's say, what would you want? What would they want? That's the ideal, is knowing exactly what they want. Actually, the ideal is they have written instructions about exactly what they would want. If they don't, which most times, honestly, people don't have that, then you want to go with what you know they would want. If you don't know that, then your next thing is, what do you feel would be in their best interest? So let's say, using the example of a stroke, and let's say that your loved one has middle stage dementia, okay? And the doctor is saying, this is a massive stroke. We're not sure what the outcome is going to be. We just don't know. It looks likely that there's going to be some paralysis, kind of the doctor goes through the whole thing. Then you need to make a decision. So do you want all the bells and whistles, or do you want to focus on quality of life? And so these are really hard decisions, hard choices, right? That you don't want to make in the midst of a crisis, which is why I encourage you to spend some time, unpleasant though it is, speaking about that now, or thinking about that now, preferably getting all of these things in writing, if at all possible, like seeing an attorney and, getting your documents sorted out and together. But short of that, these are the types of things that decisions you're going to need to make during a hospitalization. So, and hopefully it's not that dramatic. Hopefully it's a choice of, are we good with the antibiotics, right? That would be a better case scenario. But you will have to make decisions. So the best thing, the easiest way that I have found to be able to do that effectively is, let's look at what's the point of this treatment? What is it supposed to accomplish? Is that realistic based on what your loved one's life situation was prior to the hospitalization, or the thing that caused the hospitalization? And then what can we expect with XYZ treatment, right? So let's say it is antibiotics. Let's say your loved one has an infection, the doctor's recommending antibiotics. Okay, so what will happen if the antibiotics work? What's the expected outcome? What's the expected outcome if the antibiotics don't work, or I choose not to do those? So there are some things to ask, but like the great Stephen Covey says, begin with the end in mind. So we want to go, what's the worst case scenario, and kind of work our way backwards from there, so that you can become a little bit clearer on, because it can get easy to fall into a rabbit hole of, well, for example, she's had a mammogram all these years, so she should still have a mammogram, even though she's 85 years old with advanced dementia. Okay, well, you can imagine, if you've ever had a mammogram, nobody likes to do that, right? Especially if you don't understand what's going on, that's going to make it even more difficult and a much harder sell, right? Then what if the mammogram comes back bad? Then what? Are you going to go with a biopsy? What if the biopsy comes back bad? Are you going to go forward with chemotherapy? Are you going to go forward with radiation? For how long? So these are the types of questions I'm talking about. So you just want to be clear on, what outcome are you looking for? Even if you're clear in your own head, that's going to help you ask good questions, which leads me to my next tip. Oh, thank you, Makisha. And please, everybody who's in here, feel free to jump in with any questions and comments that you have. Absolutely. So you want to be an active listener, meaning when the medical team comes in, feel free to ask questions. Always ask questions so that you understand what's going on and what they're trying to accomplish. And when they're explaining things to you, this is what I always recommend. First of all, write it down if at all possible, but that's just my preference. Whip out your phone and record so you're clear on what happened. probably any professionals watching this would be like, no, don't whip out your phone. They don't like that. But you know what I'm saying? You need to be clear on what happened, because especially in the midst of a crisis, you're probably not going to be clear. It's probably, everything's going to be a little bit fuzzy, right? A little bit of fog around you. So you want to be able to explain it to somebody else in your family who wasn't present. That's kind of my watermark on, did I understand this or did I not understand this? So when somebody's conveying information to you, you want to be able to have the thought like, yes, I can easily explain this later. I can easily answer questions later. If you don't feel that way, somebody hasn't explained it to you well enough. So you need to ask some more questions, okay? And that's, again, one of those things to start off with is, well, what are we hoping for if we do this treatment? Why this treatment instead of that treatment? So those types of questions. And it's perfectly okay to ask questions. I always say run from a professional who's saying, oh, you're asking too many questions, because no, it's your loved one. This is your family member. It's kind of a big deal, right? And the professional should want to work with you and not only help your loved one, but help put your mind at ease and make sure that you understand what's going on. So that seems reasonable to me, right? Okay, the next one is, all that said, you do want to be realistic, okay? So, and what I mean by that is you want to, we all want a miracle, and honestly, I always say, leave room for a miracle. Why not? Be open to it, right? The reality of this disease process, though, is that we know some things are true about it. It's chronic, meaning it never goes away. It's not curable. It is progressive, meaning it always gets worse. And it is incurable. Ultimately, it is terminal. So those four things are always true. That said, what can we do to improve quality of life? And in case my bias hasn't been clear already, I am very much in favor of quality of life. I know some people disagree with me and are very much about quantity of life. Prolonging life, so that as long as there's a heartbeat, then that's what is most important to some people. I have a different view of it, and I really feel that quality of life is the main thing. So that's me. That's my bias. I'm up front with it. Okay, Makisha's with me. All right. So the dog needed to run there. So you want to know what is realistic, right? So for example, if there is someone who is, say, 95 years old with a hip fracture and chronic low blood pressure, not high, low, and advanced dementia, it's probably not realistic to think that they're going to have surgery to fix that hip fracture, because the low blood pressure would put them at risk for anesthesia. Their overall conditions, or what's called comorbidities, would make it a risky surgery. So we can have that room for a miracle, and we can have that hope. And I definitely don't discourage positive thinking. But, I'm a Capricorn. I'm very pragmatic. So let's also be realistic about what's possible, right? And what's probable. And the medical professionals can help you figuring out what's possible and probable when you're asking those questions and when they're recommending treatment. I got to be honest with you. There are some people out there, some professionals out there who are fantastic with dementia, have a ton of experience with it, and are going to tell it to you straight up. There are other professionals who do not like to deliver bad news. And actually, I would say that's true about all of us. None of us like to deliver bad news. We hate it, right? Because nobody wants to be that messenger. But, most of us pull on our big girl underpants and do it anyway. Some doctors in particular, though, God bless them, have a real hard time bluntly delivering bad news. And so they don't. Makisha says, knew you were a Capricorn. My best friend is as well, and she's my voice of reason. Well, thank you. I take that as a compliment. So just be aware that all of us, like I said, my bias is quality of life. Just be aware that every human being has their biases based on their experiences, and some people just have a hard time pulling on the big girl underpants and telling the truth. Okay, my dad's blood pressure gets low and he's been getting dizzy. Put the rest of that up again. I think that was Leilani, because I only got to the part that I read out loud. So put that back up and we'll talk about that, okay? And then in the meantime, the 7th tip is be proactive to avoid repeat trips to the hospital. So, and that's where I'm happy to share that guide that I have on some common situations that happen for people living with dementia and what you can do to be proactive. And it's things like a urinary tract infection or constipation. I can't remember. I think there are like 7 common things on that list, and some things that you can do at home to manage it so that you don't end up going back to the hospital. They're saying we may need a pacemaker for him to regulate blood pressure. He's 80. Okay. I don't think I've ever heard of a pacemaker being used to regulate blood pressure. Do you mean heartbeat? Because that seems more consistent. Okay. All right. I was like, wow, maybe I haven't been keeping up. Okay. So that's one of those situations. Okay. He has an irregular heartbeat. Okay. So he has it, and that's an arrhythmia. That's what that's called. So that's okay, Leilani. So that is a situation that I'm talking about where you want to begin with the end in mind and ask those questions about, what should this do? Hi, Hubler. Thanks for coming in. What should, if we do this treatment, what are we expecting the outcome to be? And, paint me the rosy picture, what's the best case scenario, and then paint me the bleaker picture, what's the worst case scenario, because I want you to have all the information so that you're able to make a good informed decision, right? Makes sense? So let me refresh again and I'll hit the 7. He has an advanced directive already. And don't you just love him to pieces for that, Leilani, so that you don't even have to guess? He already said what he wants. I mean, that was okay. Hubler says, I want to work in a hospital as a clinical dietitian. Great goal. So, refreshing, I am Christy Turner with DementiaSherpa.com. I'm your Dementia Sherpa, guiding you through rough terrain because dementia is rough enough. You don't need any extra added layers of difficulty. We just need to know what works and be able to do that. So today I have 7 tips for you on navigating through hospitalizations. And they are this. So number 1, you want to be there because hospital is a super scary place for people living with dementia. Number 2, you want to be an advocate. Hi, Chili. Thanks for coming in. Number 2, you want to be an advocate. So people living with dementia have difficult time being their own advocate. Sometimes it can just be having difficulty saying what's on their mind or reporting pain or coming up with a word to say, or all of that can happen on a day-to-day basis, let alone when they're ill or have an infection. That makes it even harder. Okay, Makisha says, psychosis, is that something that may come back, happen to my mom? Yeah, psychosis is actually a psychiatric term, but a lot of times in the dementia world, that label can get tossed onto people too. What I've typically seen psychosis in dementia, what I've typically seen it happen as a result of is a really severe urinary tract infection. So it is, and then there also can be auditory problems or sensory problems like visual perception that can make auditory hallucinations or visual hallucinations happen. And then it can be so frightening that the person can become really, it's so real to them. It feels so real. Their experience is so real. And then boom. Yes, the result of medication and UTI. That absolutely can happen. Should it come back? Hopefully, no, it shouldn't, because I assume you got the medication straightened out now. UTI, that's one of those things I have on that resource I was mentioning, where, you know, how you can try to avoid that happening again in the future. Although it's difficult. It's one of those things you got to continuously stay on top of. Typically, the quicker your response, the less impact it's going to have. Yes, off the meds that caused it. Okay, awesome, Makisha. Okay, so let's see. Number 3 was be clear on the outcome you want. So that leads us right into number 4. Ask a lot of questions. Be an active listener. Keep asking questions until you're clear on what the recommended treatment is and that you can explain it to someone else. Oh my gosh, Mr. Relentless is here. Holy cow. Wow. I feel like such a huge deal. Thank you so much for coming in. Delirium is usually from meds or UTI, things like that, versus psych diagnosis. Yes, Chili. Yes, yes, yes. Bam! Mr. Relentless, thank you. Yes, what Chili said. Absolutely. Absolutely. So, you've asked questions, they've explained it to you, you feel confident that you can explain it to somebody else in your family later. That's perfect. Take notes. Or, as I said, whip out a recording device, although you'd want to do that surreptitiously because most places are like, don't do that. So, and I think everybody knows why, but my point for you is to make sure that you understand what's going on so you can be a good advocate. You want to be realistic about what it is that can be accomplished with this hospitalization, right? And then you also want to be proactive so you avoid having to get back into that cycle. I've seen people who are in this constant hospitalization cycle. It's not good for anyone. Of course, it's definitely not good for the person living with dementia, but it's really hard on the family too. It's really tough. So if that keeps happening, there's a reason. And a lot of times it's only when we're looking back in hindsight that we understand that there's a pattern here, okay? But in general, just kind of look in the last 30 days, then look back over the last 90 days, the last 180 days. Is something going on here? Does the same thing kind of seem to still be happening? That means that either the treatment that's being given is not effective, or there is progress in the disease, right? So there's disease progression happening and we need to look at what else we can do. Hi, Lisa. Thanks for coming in. So one of those two things, and if you need help figuring that out or you need help with any of this stuff, please reach out to me. I'm here for you. Periscope daily, at Dementia Sherpa on Twitter, Dementia Sherpa everywhere, dementiasherpa.com, Facebook Live, the whole enchilada. So please reach out. I know if you have a loved one who's living with dementia, it's hard. It's scary. I've been through it 7 times in my personal life. I've helped over 1,000 people living with dementia professionally. I've been doing this for 15 years. I do know it's hard. It's exhausting. It feels isolating. It's frustrating. It's scary. So that's why I'm here. I'm here to help you. All you got to do is reach out and let me know that you need some help. I'm happy to help you. As I said at the beginning and repeating again, I do have a free resource guide. All you got to do is hit me up on social media and I'm happy to give it to you. It's like 7 common situations that people living with dementia face that can wind them up in the hospital if we don't manage it well. And a lot of times we don't manage it well because we don't know, right? We can't know what we don't know. So if you don't know that some of these things you're seeing are a sign that things could be going sideways and end up leading to hospitalization, you can't do anything about it. So this guide is just designed to help you know that, oh, these are signs of things and there are some things that you can do to hopefully avoid hospitalization. I feel like I just spewed a whole bunch of stuff. So thank you everyone for coming in. As always, I am happy to answer any questions here while we're live or later. Reach out to me on any social media platform except Snapchat, which I say is for the kids. And I am happy to help you. Again, I'm Christy Turner with DementiaSherpa.com. I am your Dementia Sherpa, guiding you through rough terrain, and I will be back here tomorrow on Facebook Live and Periscope at 1 p.m. Pacific, 4 p.m. Eastern. 9 p.m. British summertime. And we're going to talk about loss of independence. This is what my blog post was earlier in the week. It was kind of lengthy, but loss of independence, what do you do about that? How can you support somebody through that? All of that kind of good stuff. So to answer your questions, Turner Dizzy, it's Victoria. Hey Victoria, how you doing? Thanks for coming in. I am just wrapping it up. I appreciate everybody coming in and being here today very much. Thank you so much. And I'll just hit the 7 points again real quick since Victoria just came in. So you want to be an advocate. Thanks for coming in, Chili. I appreciate it. You want to be an advocate for your loved one. You want to be nice to the professionals because that just kind of helps grease the wheels, even though we do know we're not meeting you on your best day. Number 3, you want to be clear on the outcome that you want. Okay, yeah, absolutely. Thanks, Victoria. You want to be there, so you want to be present with your loved one because it's a scary place and they're not feeling well already, and it's easy for them to be confused on a good day, let alone when they're feeling like crap. You want to be realistic about what you can do, and kind of press the professionals on that about what's a realistic outcome, because we don't want to be doing stuff just for the heck of it so that somebody can say, well, you know, we tried 6 different things and nothing worked. If we already know 5 of those things aren't going to work, let's not mess with those 5, right? So you want to be realistic about what actually can work. You want to be proactive when you're managing the situation at home so that hopefully you don't end up back in this situation, back at the hospital. And finally, you want to be an active listener and ask lots of questions so you can explain it to somebody else later. So you don't let the professional leave until they have answered your questions, because that's what we are here for. So you get your questions answered. As far as I know, there is not a medical professional I have ever met that pays you, right? Other way around. You're paying the money. That means they work for you. They answer your questions to your satisfaction. So they may not give you news that you like, right? But you should understand what they're saying, why they're saying it, and what the plan is, and be able to repeat all of that information to somebody else in your family who isn't present, right? Okay, so that's it for today. Thank you so much for coming in. Hope to see you here tomorrow, 1 p.m. Pacific, 4 p.m. Eastern, 9 p.m. British summertime. Thank you so much. Have a fantastic day. Remember, you're doing one of the most important things you can possibly do, and you are not alone. I am here for you. Love you guys. Thank you so much for joining. Reach out for support if you need it. DementiaSherpa.com.